Springfield's morning news, catering to Central Illinois, where you've had some people questioning what's going on with their health insurance, with their medical providers, and this all because of some back and forth that's happened between Springfield Clinic and Blue Cross Blue Shield, and then the state of Illinois getting involved, issuing fines. To talk about the Springfield Clinic side of this ongoing discussion, we're joined now by the Vice President of Brand Experience and Advocacy for Springfield Clinic, Zach Kerker. Zach, thanks for taking time with us this morning. It's been an interesting couple of years here as Springfield Clinic's had to deal with what now the state of Illinois says is some wrongdoing by Blue Cross Blue Shield. Walk us through what's happened in the most simple terms that you can.
Yeah, good morning, Greg. Thanks for having me on. So if we were to go back and look at the timeline, it was about May or June of 2021 when I think that it started to feel real that something could happen here. And typically a dispute between a healthcare organization and the insured, a lot of times that gets sorted out at the 11th hour. And I think most everybody was expecting that, but we had tried to tell everybody this doesn't feel like one of those situations, unfortunately. And fast forward, it's been almost 2 years now since that point. We've been out of network for over a year and a half with going on a year and a half with Blue Cross Blue Shield. And, no doubt the community has been disrupted by that. No doubt there have been, patients who have Blue Cross Blue Shield who've really had a hard time trying to find a provider to get into in, short order. And we'd love to have a remedy to that. We'd love to be able to have every one of those patients come back into Springfield Clinic. We work every day towards that goal. We do think that this fine from the Department of Insurance is an important step in that process, but we think that there's still work to be done.
So when it comes to this fine, they were fined twice. Is that right? The most recent one being like $600,000 or something like that?
That's correct. So the first fine came early in this process, right after we had gone out of network, because they're supposed to inform the state when you kick out a large healthcare organization, and that hadn't happened. So that was a $339,000 fine. To be honest with you, Greg, the $600,000 fine that's come down now, we're trying to understand exactly what it means also. And we know that our patients are, because we've heard from our patients who are confused by that. I think a couple of things as we've stepped back to look at what's going on is there are still major issues with the online directories that Blue Cross Blue Shield posts. For example, there are still Springfield Clinic doctors listed on that directory. Clearly, we're out of network. Those doctors are not available in network to patients. So that's an issue that still hasn't been resolved yet. There's still a lot of doctors that are either unavailable or don't work in the market listed in those networks. And so what the result is for patients is, first off, they're very confused because they're trying to figure out, all right, well, it says that these physicians are available to me, but they don't seem to be. And just this week, I'm dealing with, patients' issues that we're talking about 13-month wait to get into neurology, a 6-month wait to get into an ophthalmologist, long waits for OB and allergy and radiation oncology. And, I think what has happened, Greg, is over the past year, there's almost become this sense that waiting 6+ months to see a physician is normal. That's not normal, and it shouldn't be normal. And so if you're a patient who's experienced that and well, maybe this is just what it is. In order to get in and see a rheumatologist, it's an 8-month wait, and that's just how it should be. It shouldn't be that way. And we're fighting for, changes that will secure that access for patients in the future.
Zach Kerker joins us. He's the Vice President of Brand Experience and Advocacy at Springfield Clinic, and we're talking about the latest back and forth between Springfield Clinic, the provider, and Blue Cross Blue Shield, the insurer. And Zach, I think you're right there, and as far as it should not be normal to have to wait 6 months to get into a specialist, a doctor. A lot of times people have things happen, a cancer diagnosis, for instance, that sometimes it might take a week or two to get into a doctor for a scan or for the next steps, but 6 months or something. These are wait times that should not be the norm. So talk about, if you can, here just briefly about what the next steps are. How should this be resolved, and is there anything that the State House needs to do? Is there anything that the Department of Insurance has to do, or that Blue Cross Blue Shield could do to remedy all of this?
Well, I think first off, from the beginning, we've been open to a compromise with Blue Cross Blue Shield. The only thing that we've ever asked is that the we're just looking for an agreement that's within the market range. And by that, I mean, we just wanted to, the similar to what every other insurer does with us, the same agreements that we have in place, no more, no less. And we think that that's a totally fair ask. We think that it's really important for the long-term sustainability of healthcare in Springfield, Illinois. There are major economic issues right now in healthcare. And so every healthcare organization that you see is struggling to figure out between staffing and increased costs and all of these things. And every insurer that you run across, they're reporting year over year profit margins, record proportions. And we just have to all coexist. There's an important spot for all of us in that ecosystem. And so we certainly are interested in finding what that compromise is that would allow patients to get back in. Because the reality is that when Springfield Clinic is in Blue Cross's network, none of these access problems exist like they currently do in Springfield. It's just the honest to God truth. So I think that's the most important thing, is to figure that out. But I do think long term, we really do have to step back and look at what are we doing to protect patients from this happening again in the future. It's one of the reasons why we put together Springfield Clinic Advantage, which was an alternative to patients as far as the health plan is concerned. A plan where you never have to worry about being out of network with your Springfield Clinic doctor. Then you'll always be in network. Very competitive plan that looks at saving the cost of healthcare over the long term. But I do think we have to step back and look at potential legislative remedy. I think that the Department of Insurance has tried very hard to do what's right, but like many, I think that there's staffing is tough, and having the resources to do very complex work, which is what this is difficult. And so, I think that, and then the question is the authority there to really bring influence over these big insurance companies that have so much power and money and influence. And, I think that that's all stuff that we've got to step back and look at, because the long term, making sure that this doesn't happen again, is something that we are acutely aware of and hopeful to find remedy to. And
I know we don't want to get to any spot where people have to wait months on end to go see a doctor. It's not what this country's medical system is supposed to be. And I think that everything needs to be done to continue to look at this and really focus on the patients and the end consumer, the costs and the waits and their health and so on. Greatly appreciate your time, Zach Kerker. It's here with Springfield Clinic. You're the Vice President of Brand Experience and Advocacy. Keep us posted on what happens, all right?
We'll do, Greg. And if I could real quick, 217-391-7086 is our patient advocacy center. If you're stuck in a situation like this, call us. We have spent the past year plus working with patients, trying to figure out ways to get you in more quickly, cost-effective measures to allow you to see the people that you need to see. So that number is 217-391-7086. That team has been really great with working with patients in those situations. So please don't hesitate to give us a call, and we'll do everything we can to help.
Zach Kerker, Springfield Clinic, greatly appreciated. Have a great day.
Thank you, Greg. You too.